As Jeff just said, I'm Jude, and I'm Head of Strategy and Planning for Hitch Marketing. We're an integrated agency specialising in social marketing in the UK, and I'm talking to you today about how we've used digital to address taboo topics. But before I do, I'd like to introduce you to this chap. When I was writing this presentation, I realised he didn't have a name, and I thought that was a bit sad. So I've called him Washington in honour of this conference today. Washington helped us to target men who have sex with men in a campaign, a sexual health campaign, which aimed to encourage men to access sexual health information and services. Because sexual health is a taboo. Can I get this to change now? Down. I have a blank screen now. There you go. Sexual health is a taboo. So in plain English, this means it's outside of the social norm as a practice, or indeed, in this case, as a topic of conversation. And it's one of 3 taboos. I am pressing the green one. Thank you. As an agency, Hitch delivered the end-to-end campaign Get Checked for Hertfordshire, which is a local authority in the UK. And it aimed to increase the number of men accessing sexual health information and services. It started with secondary research and moved on to qualitative research with stakeholders, and then quant with the target audience. We took that information into the creative process, the messaging process, and took that into co-creation. And it revealed that 43% of men never talk about their sexual health, or if they do it once or a year or less. So it was hardly surprising that 81% of men didn't know where their nearest sexual health service was. And I've chosen it as a case study today because it's reasonably small scale, it's real life, and it worked. I am pressing the green one, I promise you. The second taboo is prejudice and discrimination, and this is also an end-to-end project I'm working on with my colleagues from the National Social Marketing Centre for the charity British Red Cross. And it aims to reduce prejudice and discrimination towards refugees and asylum seekers. The target audience here is the worried middle. That's people who are not overly negative or positive about refugees and asylum seekers, but have concerns and worries that they never discuss. And the third taboo is abstinence. Who thought abstinence was a taboo? You might be aware of Dry January, which targets increasing risk drinkers, and it's a project that Hitch has been working on since its inception in 2013. And in terms of it being a taboo, we discovered that during the evaluation, the ongoing evaluation, that there's a cultural assumption that in certain situations, people will drink and get drunk. And people didn't really know how to say no to a drink, and were feeling uncomfortable with introducing that into the conversation. So they are my 3 taboos, if I can get this to work. So, we know from our quant that 47% of men surveyed preferred online as a source of information on sexual health. That was second only to their doctor. So this became an integrated information and education campaign linked to local services that used digital channels as a priority. I mentioned co-creation earlier, and this helped us to refine the target audience. So Jeff was saying yesterday in his presentation about segmentation and targeting. We didn't want to target all men age 18 to 50. If you're a married man, a happily married man, trying to start a family, then you need to have as much unprotected sex as you possibly can. You don't necessarily need to access sexual health services and information. So this brought us to a target who also engage in other risk-taking behaviours, and they include gambling and drinking. And we also identified subpopulations, including men who have sex with men and men who are black and minority ethnic. And this really helped us use digital. We used pinpoint mobile advertising on websites and apps, which targeted down to the location so that we could target areas of high prevalence of sexually transmitted infections. But more importantly, it targeted according to user and online buying behaviour. So we know that we were getting through to men who engage in these risk-taking behaviours. We created messages and creative that resonated, and you know, maybe you don't want to hear about click-through rate, but actually it was really important with this campaign because it was taking men through to information on sexual health. Comparing impressions to clicks, we know that men saw this advert lots of times before they clicked, and when they did, they clicked in the evening on an iPad, so we know that that correlates with their availability and also with privacy. We used Facebook, including paid for, and the Twitter app Periscope for live video streaming. And my last point on this slide is that we saw a correlation between the campaign and an increase in HIV testing kits being ordered online. And I think that's really important when we're looking at behaviour change, because the next slide talks about some numbers. Can I go backwards on this? 10,000 men accessed sexual health information because of this campaign, which is really important because we know from their online journey that they went on to visit partner organisations that can support them with their sexual health. And we also know from communications with stakeholders that there was an increase of queries and an increase of service use. I haven't got much time left, so can I have a bit of extra time for my technology? Okay, so that's education and information, but this is entirely different. This project is a labour of love. It's, as I said, about prejudice and discrimination towards refugees and asylum seekers. From our own qual, we know that the worried middle in C2DE occupations living in less affluent areas don't believe anybody. They don't believe the national press, they don't believe the government, they don't believe politicians, they don't believe social media. They only trust their own experience and the experience of the people around them, and then they find sources of information that verify that what they were thinking was right. So a mass communications campaign is not going to work with this audience. So the primary intervention with this was not digital, and I think that's really important when Jeff was saying digital is part of the answer. It's not always all of the answer, and it isn't with this project. So primarily, Facebook is being used to promote the benefits of local activities, and we're funding local activity providers at a grassroots level to provide opportunities for refugees and asylum seekers to have contact with members of the traditional community. We're using contact theory, which proves that providing this environment will support a reduction in prejudice and discrimination. And this is the clever bit, because a part of that fund agreement, we're using these grassroots influences to support the aims of the project using social media. Local and peer influences are the only credible sources in this environment, and we are matching those messages up with real experiences to get through to this group of people. I have gone over my time, so I'm just going to click through this really, really quickly before I get shouted at. Dry January, an integrated campaign heavily reliant on digital, and this one gives some big figures. And I think the most important part of the intervention mix with this one, I've gone ahead. Started in 2013 with 4,000 sign-ups. 2017, 6 billion impressions. As I say, support, really, really important part of the digital intervention mix. There was an online community which supported itself, which is a beautiful thing. We used video with experts to frequently ask questions. We had an email program which was built on experience and feedback, and the app helped users calculate the calories that they hadn't consumed and also the money they'd saved. Now, if I'm going to ask you to blink, because I don't have the opportunity to do my last slide. So 1, 2, 3, blink. And I will take you. Close your eyes for a bit. Thank you for listening. Sorry I went a little over.